The area of North Lawndale on the west side of Chicago has a poverty rate more than twice that of the rest of the city. It is a food desert, meaning residents struggle to get access to fresh, healthy food. On average, those who live in this neighborhood can expect to live 16 years fewer than those just a few miles away in downtown Chicago.
It's the obituary, they done passed away.
Walter Primus III has turned his front window into a memorial for all those on the block who have passed away, some at a young age due to gang violence. He says one of the issues is a lack of facilities.
Kids, they don't have enough playground, and it ain't enough for them to do when they get home from school.
A recent study has once again underlined health disparities in the US. Research led by Yale University found that between 1999 and 2020, black Americans suffered 1.63 million excess deaths compared to white Americans. Excess deaths are defined as the difference between actual deaths and expected deaths. And those deaths over the 21-year time period studied add up to a cumulative loss of more than 80 million years of life. Aisha Jaco is the executive director of West Side United, an organization that aims to reduce inequalities in healthcare, education, and the local economy on Chicago's West Side.
If we think about working to bridge the gap, we've got to look at root causes. We believe that if you look at the economic vitality of residents, their access to education, the neighborhood and built environment, and their access to health care combined, that there is a solution to bridging that gap.
West Side United works in partnership with healthcare providers. Dr. David Ansell is the Senior Vice President for Community Health Equity at Rush Hospital, which is located in Chicago's West Side.
The gap is largely driven by chronic diseases, things like heart disease, cardiometabolic disease, diabetes. So if we can close the chronic disease gap, we can close that life expectancy gap. But medical care is not enough. Poverty and racism are vectors for disease.
The Yale study also shows how the COVID-19 pandemic highlighted the gap between black and white Americans. Health figures have shown that black Americans were at times more than twice as likely to die from COVID than their white counterparts. The COVID-19 pandemic and the disproportionate death toll on black Americans once again thrust the spotlight on health disparities in the US. The authors of this latest report say new approaches are now required to promote health equity in the country. And they're also calling for better ways to keep track of the issue moving forward. West Side United is about to build a new wellness centre in the area, in addition to a grocery store. And the group believes other cities across the country can learn from their experience.
Our goal used to be to decrease that gap by 50% by 2030. Now we want to eradicate the gap. And we do see this as a replicable model in communities that have similar demographics and disparities.
We need to be led to the solutions by the communities most affected. The way we're doing it historically doesn't work.
For this area of Chicago at least, the hard work to close the health disparity gap is underway. Dan Williams, CGTN, Chicago.